Good afternoon, everyone. This is County Executive Pat Ryan. Thanks for taking the time to catch up with us this afternoon. I'm going to talk about what's going on with both the current COVID situation as well as our progress and still some of the challenges ahead in terms of our vaccination efforts. I will say the good and encouraging news of this week is that we got our first county-led point of dispensing site open, our first pod site at Kingston High School. I was there yesterday, there this morning, checking in. That is going extremely well. The challenge, of course, is that we don't have near enough the amount of vaccines that we need to get through all the people that are expressing interest and to get through our population quickly. So I'll talk more about that in a moment here, but there is some progress at least, but we need to speed it up, and we're pushing on the federal government to do that. In terms of the COVID situation, though, to start, we actually are holding pretty much steady to what we were at our last update. So we will take that as a relative win in that really from before Thanksgiving till now, we've seen an increase, and it's a little too early to tell, but quite possible that at least things are starting to level off, and I of course hope that that is the case. You'll see that here in the numbers. So total cases cumulatively continue to grow, of course, at 7,607 since the beginning. Our testing at almost 214,000, 5,500 plus recovered. Unfortunately, we did have an additional 3 fatalities since my last update on Thursday, so we are still seeing nearly once or a daily loss of at least one of our residents, and that has started to slow a little bit, but of course not nearly as fast as we want. And we're at 165 right now, lost to COVID in Ulster County since the beginning of the pandemic. Our hospitalization numbers are actually down from last update, so that is good news. We're at 27 hospitalized right now, 4 in the ICU. You can see on the graph the possible beginning of a downslope. Again, still a little early to tell without baking in the holiday effects, but we are now pretty well into January and seem to be holding relatively steady, as I said, so that is good news. We were at 32 hospitalized last update, and now at 27. Active cases, this is another point of encouragement. You can see it very clearly on the graph. We were near 2,500 active cases at one point. We are slowly ticking down and now at 1,940 in the county. It would be very, very good news and encouraging news if we continue to see that slope of that graph decline. Again, to set reasonable expectations, we do think there's a chance that it may go back up again, or at least stay level given the holiday gatherings. But I'm going to be optimistic and hope that all of you heeded the public health experts' advice and did minimize those gatherings like our family did, and hopefully we will continue to see those signs in the data and in the numbers. The one point for large concern is that the new positive rate is still quite high. So as we look at our graph showing new positive cases and the amount of testing we're doing, you can still see we're up near 140 or so new cases each day. You can see on that graph, still at near record highs for the number of new daily positives each day. As a percentage, we are still very high in Ulster County. The 96-hour average of new positives was 9.67% over the last 96 hours since our update. To give you the exact numbers, we tested 5,098, and had 493 new positives. So again, that puts us at a 9.67% new positive rate. That is a number that we have to get down. As long as that number remains really definitely over 5, but really even over 1, we're still sort of fighting against the spread and near or in a community spread situation. So that's a number that we were looking at to see the reemergence, which we saw. We'll continue to look at that number to hopefully see that begin to tick down. We all, as we know, have a part in making that happen. In terms of our looking out projections, you can see the best, middle, and worst case here, still at alarmingly high numbers unless we can start to get that new infection rate down. This projection number is really just based on saying, hey, if the current rates are what they are, which are very high, this is where we're headed to. And you can see very clearly from mid-November, we've just been on a pretty steep incline there that lasted much longer and was much steeper than the incline we experienced in the first wave. And so that is a reminder, loud and clear in the data, that we very much are still in the second wave, that the rates are very high. We had the most fatalities in the last month to 5 or 6 weeks. We had the most fatalities that we've had at any point in the pandemic. So despite all of us so desperately wanting this to be over, it is not, unfortunately. And we have to continue to take it seriously and follow through on those precautions. Our hospital capacity, another point of relative good news, we are back now below the level. We were at a concerning level for about a 2-week period where we were above the threshold that might have imposed restrictions. We are back now below that threshold. We upgraded our numbers and our capacity to say that we now do have, once again, sufficient capacity for the need for hospital beds, ICU beds, and ventilators. You can see those numbers there on the screen. And you can see 27 hospitalized, 4 in the ICU. Just as a human reminder here, we're talking about numbers every update. We're talking about data and figures. But I really urge all of us, and our team, my team, and I try to do this. I think about those 27 residents. Many of you watching probably know one or more of them or related to one or more of them. They are so sick from this virus that they're in the hospital, have been many for many days or even weeks, 4 of them clinging to life on a ventilator and in an ICU. And we just can't lose sight of that these are our friends and our neighbors and our colleagues that are suffering from this. And I want to, again, send my love and my best wishes and all the positive energy I can to those 27 individuals, to everybody that's sick, and to those that are still recovering. This is a horrible, horrible thing, and I don't say that to make us fearful. I say it to just remind us of the humanity of the situation that we're in, and that we don't lose that through just seeing this agonizing set of numbers and toll of fatalities. And I know each of us are thinking about that. So how do we change this? It's the same playbook that we know works if we all work together to execute it. It's wearing masks, it's washing hands and using hand sanitizer, and it's maintaining distance when you're in public and continuing to avoid getting together with small or large groups of people, especially indoors, given the weather. We have said this before, but we now know that is the greatest point of risk that someone could take on, would be to get together in a social gathering inside, especially for a longer period of time where you're sort of sharing air, given that the virus is aerosolized and we know that is how it spreads. So please keep in mind that human toll of what's happening. Think about those that you love that are vulnerable, and adjust your behavior accordingly. And once again, I mean, we're seeing 95, 99% of people doing the right things. We just need to urge those other small percentage that aren't to please do the right things, and we can get this back under control like we did before. The rest of the update, I'm going to talk about what's going on with our vaccine distribution plan. As I said at the beginning, the good news here is that we are making progress. We stood up our first site, our point of dispensing site at Kingston High School Fieldhouse. That is up and running, and I have to say it is a very well-run operation, and I want to really thank our team. I want to thank the Kingston High School team. We have dozens, if not hundreds of volunteers helping. We have restaurants providing food. We have everybody pulling together to make this site work, and I'm really, really proud that is happening right now, just about a mile or so from where I'm sitting. The challenge and the not so good news is that demand for the vaccine is far higher than the supply that we have right now, and I'll talk about why that is. But that is a real challenge for us in Ulster County. It's a challenge for everyone in New York State and everyone in the country, all experiencing this. So I know this is a very difficult ask, but I do now and will continue to have to ask and urge for your patience. I and all of us are pushing as hard as we possibly can to address this, but largely it's a problem that lies at the federal level with getting more production from the pharmaceutical companies of the vaccine. I do want to talk again about how our operation is running in Ulster County. I'll do this quickly since I hit on this last week in greater depth, but this graphic shows you really what our infrastructure is like. It's a hub and spokes with our vaccine operations at the center, supported by the Mid-Hudson Regional Hub. We have our county-led point of distribution sites. Our first one opened Monday at Kingston High School. Our second one is set to open at Ellenville Regional Hospital, assuming we can get enough doses, which right now we don't have, unfortunately. We also have, and you can see them on the left side of the graph, a whole other set of partners from pharmacies to hospitals, our federally qualified health centers, and other medical providers who also over time will become eligible to distribute. And then we're working through our vaccine coalition of trusted voices and community leaders to make sure that we're doing this in a community-driven and a community-led way. What does that look like on the ground? Here's an update on where we are with the supply side of this. And there are two main aspects to how this runs. First, you have the supply, how much vaccine is available. That's really controlled by the federal government and effectively really limited right now by how quickly Pfizer and Moderna and eventually other companies can produce the vaccines. So that's the supply side. The other piece is the distribution. That's where state government and local governments come in, where we're setting up these sites as well as our other providers to actually get the vaccine out. We're doing well with distribution, not so well with supply. Right now in Ulster County, over the last month or so, here's what we have received in terms of vaccine doses. So in the last 3 weeks, we've received 4,300 doses. Those were primarily and still are primarily focused on Phase 1A healthcare workers. And then this week we received a total of 1,200 vaccines, at least at this point in the week, from New York State, which is getting them from the federal government. It doesn't take a mathematical genius to see quite clearly that with 180,000 plus residents, those numbers are just nowhere near where we need to be to rapidly get this out and to equitably get the vaccine out across the county. So I'll talk more about that in a moment in terms of what we're doing there. In terms of the distribution side of this, though, again, as a county, I think we're really leaning forward and leading here, opening our first point of dispensing site on Monday. If you could see how smoothly that operation was running, even on the first day, here's a sort of a snapshot of it, of our first folks waiting in line there. We've got a staff of near 100 people, of county workers, of volunteers, of doctors and nurses, of our IT professionals and so many others that work to get that site up and are running it now. And we will continue, as long as we have vaccine, to run that site 7 days a week, 10 hours a day, and continue to push our part of this, which is this distribution portion. In terms of right now, our throughput at the Kingston High School site, as I mentioned a few weeks ago, At maximum capacity, assuming we have enough doses, we can do up to 1,500 doses per day at that site, which would get us to 45,000 at that site in a month. Right now, however, given the limited doses, we are doing just under 500 a day. So yesterday on our first day, on January 11th, we did successfully administer 480 doses. Those were all of the appointments that we had set out, which filled up very quickly, and then we distributed those. Today, we're in the middle of distributing another 480. Tomorrow, the same on Wednesday. At this point, given the fact that we only received 1,200 for this week from the state, who got it from the federal government, if we don't receive more vaccine doses, we will have to halt our operations on Thursday at some point as we expend that 1,200. So we are all echoing at every level in every county in urgent plea for the federal government to do everything they can to get more vaccine to everyone down on the ground, and of course here in Ulster County. It's just very simple at this point. As I said, the demand is far greater than the supply, largely due to the slow scale up of production on the federal side. And we need the federal government to act and do everything they possibly can. I know that people are working this, but frankly, it's just unacceptable that we haven't picked this up more quickly, given that we know even, just here in the county in the last few days, we lost 3 more residents. We've lost nearly 60 in the last, since December 1st. And it's just unacceptable that we in the United States of America can't get more of this out. At the New York State level, to give you a sense, New York State, which has 20 million plus residents, is only receiving about 300,000 doses per week. And that needs to be allocated across millions of eligible residents in the state. And then, of course, we're receiving our share here in the county. For anybody that has reached out to us, you are probably feeling the huge volume. We've gotten a huge volume of calls. We've actually had over 14,000 residents sign up on our Vaccinate Ulster site to receive more information. The good news there is that now, for those that have signed up, we are going to be sending you regular updates about what's happening and ultimately letting you know when you are eligible and when you're able to make an appointment. We'll be sending an update actually this afternoon or this evening to that group. But right now, again, the situation is just a challenge of supply. I do want to remind everyone that's signing up for this site, and here's sort of a screenshot of what that site looks like. You can go on there and do 3 things. 1, you can check if you're eligible. 2, you can just get information about the vaccine and the health risks and a set of frequently asked questions. And then 3, you can sign up. As I said, about 14,000 plus have done that so far. And what you're signing up for, you are not signing up for an appointment because we don't have enough appointments yet. What you're signing up is to be updated and to get regular communication with us. You're providing us where you live and your health category and age. That way, once you are eligible and once we have enough vaccine, we can communicate directly with you. So if you've signed up and you're one of those 14,000, you will be getting regular updates from us, but you will still eventually have to book an actual time slot, an appointment, once we have availability for you. The goal at our website, vaccinateulster.com, is just to open that communication channel, to keep that communication. Everything that we know, we're going to make sure we're getting to you directly via the email that you provide there. So thank you to everybody that has signed up, and hopefully we'll get more vaccines flowing and we'll have good news to be communicating with all of you in the coming days and weeks. As a reminder, once again, I want to go through the 2 categories of folks that are eligible right now. These criteria are set by New York State Health Department. The first phase is phase 1A. We've talked about this before. These are our healthcare workers and a whole long list that you can see there of individuals who are working in our health sector, are regularly exposed to those with COVID and need to get the vaccine as the top priority. We're continuing to vaccinate these folks. To give you a sense, in Ulster County, where we have about 180,000 people, we have approximately 15,000 residents that fit just in this 1A category. So that is a significant number of folks in 1A. Then the second category is phase 1B. This was just recently announced last week by Governor Cuomo and the state. Additional people eligible in 1B, which is now open as well, are our teachers and education workers, first responders, public safety, public transit, and anyone over the age of 75. So that is phase 1B. So if you're in 1A or 1B, you meet the criteria, assuming we have enough vaccines. And then just earlier today, Governor Cuomo further expanded the eligibility so that now anyone 65 and older is eligible, in addition to all those phase 1A and phase 1B categories. So in the last week or two, which I think is right and makes sense, we've seen a much bigger set of people that are now eligible. The problem is we still don't have enough vaccines even to get through the 1A category. So while it's good news that more people are eligible, we still need more vaccine. I want to, again, share some numbers just to give people context and to set expectations of how quickly we can get through these categories. In Ulster County, again, population 180,000, we have just that one category of 65 plus. We have 36,000 residents, so 20% of our county's population fit in that category of 65 plus. Not to mention all the other healthcare workers and other first responders and teachers that are in 1A and B. So we have nearly a quarter, or maybe even more than a quarter, of our county's population already eligible, but nowhere near the supply. And I'm hitting this point, I know, over and over, but I think it's important that we're upfront and transparent about where we're at, so that folks can continue to have that information. And I know it's not what we want to hear, but I think with that information, we can all understand that everybody's doing their best with a limited supply, and that we're all going to need to continue to have patience, and that we will be communicating to you all throughout this process. I am optimistic that the speed and the pace will pick up as the supply chain gets better at the national level, but right now we can only commit to distributing what we know we're going to get, again, in the spirit of setting those expectations. Finally, we're continuing to work with our vaccine distribution coalition. We met again last week. We'll meet again this week. I want to thank everybody that is part of that. This is really going to become even more important as we scale our operations, to make sure that trusted leaders can answer questions about the health pros and cons of the vaccine, and also get out this information, which I know is complex and rapidly changing, about the logistics and the eligibility and so on and so forth. Once again, for those of you that are able to get online, all of this information that I'm sharing, probably in a more concise way than I'm rambling it out right now, is available on our website. It's vaccinateulster.com, vaccinateulster.com. You can also link to it through our normal COVID dashboard, which I know many folks go to regularly. All your questions, or all the answers and information we have is there. We will start tracking probably in the next week or so. We'll put up on our dashboard some of the vaccination numbers. We're still waiting for higher quality data from the state in real time. Right now, we're only getting weekly updates about that. Once we can get to a daily update number, we'll start sharing that with you all as well, so we can see that number. That's the one number we do want to go up, our number of those vaccinated. So we're working on that as well. As we wrap up, I want to, as always, thank our frontline workers and all of those members of our community, thousands and thousands who are continue to put themselves at risk for all of our health and safety. My specific shout out this week is once again to the tremendous staff and volunteers at our Kingston High School point of dispensing site. Everybody from the school superintendent Patalino, school board president Shaughnessy, and all the school board members, all the staff at Kingston High School. We've got many of them working at the site, many of them directing traffic, as well as all of our county workers, health workers, and a whole set of volunteers. We have people in our county that are volunteering to work 10+ hour days for just because they want to pitch in and help and do everything they can to get us through this period and get these vaccines distributed. And I think that says a heck of a lot about our community and how, once again, we continue to rally through this. So thank you to everybody that's at that site right now. And if you know somebody working there, please thank them and give them a socially distanced pat on the back. Finally, if you do have questions, you can call our Recovery Service Center. We had an unprecedented volume of calls. We had almost 3,500 calls into our Recovery Service Center yesterday. Usually we get 100 to 200. So we did have longer than expected wait times. I apologize for that. I own that, and we're working to fix that. We are doing our best to handle the volume of calls. If you have a question that you think can be answered on our website, please do try to do that if possible. We're really trying to preserve the RSC line for those that can't sign up online and might not have access to that. So please, you can, of course, always reach out, but know that the wait times are a little bit longer right now, and you can go to our website for more information. Thank you for bearing with me on a long update here. We'll keep the information flowing. We're going to keep pushing as hard as we possibly can. I was on calls all weekend long, pushing to get more vaccine doses for us here, and we will keep pushing as hard as we can, as long as we need to. Thank you for tuning in. Our next update will be Thursday at 3 p.m. And in the meantime, stay safe and healthy, and let's remain resilient now into 2021. We will see you in 48 hours.